At our pharmacy, we treat a lot of patients who suffer from erectile dysfunction. Many of these patients will use a penile injection for treatment of this condition. For many patients, the injection is very simple. They administer it using a syringe. But some patients have difficulty administering the injections. Either they have a tough time manipulating the syringe or they just don't like needles. For these patients, we offer the auto-injector. Auto-injector offers an easier and more friendly way for some of these patients to administer the penile injection if they do have difficulties with the syringe. The auto-injector is comprised of several different components, which I'll show you now. To begin with, we have the syringe housing. Secondly, we have the injector body. There are two depth adjusters, a short and a long. We use these depending on what needle you're actually using. In the manual for the auto-injector, there is a guide that specifies exactly what setting, and you'll notice there's indications on each of these adjusters for various settings. Each needle has a specific setting and a specific adjuster. And that's very important. The last component is the needle gauge / plunger. So when we're using an auto-injector, the first thing, as I mentioned, is we have to make sure that we have the correct depth gauge for the needle. I have two different needles here that have different lengths. This is a shorter needle and a longer needle. We want the same depth on the injection regarding the delivery of the shot, regardless of what needle we use. And we determine that and guarantee the length using the depth gauge that's provided. I'm going to now actually assemble using the long adapter, which I know the depth gauge based on our manual, how this has to be set up. And then I will demonstrate how to actually measure that you have the correct setting. So I now have my adapter at the correct length. I'm going to actually use my syringe and needle, inserting the syringe into the syringe housing, and then manually pressing that syringe in. What this allows me to do is use my depth gauge to measure, and this is showing that I have 6 millimeters of penetration, and that is the desired length that we need for a proper administration. Once we have calibrated the device, we are now ready to assemble and administer the injection. Again, we have a variety of different pieces. Our depth gauge doubles also as a plunger. So what we do is insert this into the end of the syringe housing, like that. Then we take the injector body and press that gauge all the way in until this clicks. Once you hear that click, the injector has been cocked. It's ready for use. You'll notice that the plunger or indicator is extending out from the back of the injector housing. And that's very important. That lets you know that the injector is ready for use. Then we remove the depth gauge from the syringe housing. Now at this point, we would actually draw up our medication into the syringe. I'm not going to actually draw medicine into the syringe. I am going to pull back the syringe so that you can see, if you were injecting, how the syringe would appear. At this point, we insert the syringe into the syringe housing, and it drops right in. Now, the injector body screws onto the syringe housing until it is nice and firm. You will notice there is a window, and it's a little red window here. This is essentially a safety. What it's showing you is right now you cannot activate the injector. When we actually press this against the penis, that space goes away, the indicator is gone, and at this point the injector is ready to fire. So, just to duplicate an injection, we will again find the best position for the injection on the penis using the same 10 and 2 technique that we showed you in the administration technique. Press the injector against the penis. Now, the trigger is very easy to manipulate. When you have the injector pressed against the penis, the safety window is closed. It's ready to fire. You press the button, and you notice that the plunger or indicator has now gone back into the injector. This lets you know the medication was delivered. At this point, we remove the injector. The medication has been delivered. We apply our pressure and proceed with the administration technique as described previously.